We had a very good insight into the Boni-Hossain repertory by Gaurang, and it is always lot of things in homeopathy which we would plan to cover in the all the webinars which we are organizing. The next what I would like to share over here with you all is some newer things. We learned something really old and vintage from Dr. Gaurang, and now we will learn something very interesting, which is artistic use of MacRepertory and ReferenceWorks. So I'll just share with you some couple of cases about how these newer tools have helped in taking homeopathy further. Basically, when it comes to ReferenceWorks, I just imagine a whole huge library of innumerable books, and you can search any symptom from anywhere, whether it is a common symptom, it is a particular symptom, whether it is what you want to focus upon. You have infinite possibilities. So let me start with a case of jaundice. This was a case few months back with me, and this patient, a well-educated patient, he comes with the reports in his hand. You know, these days everyone is so well-educated that they always come with the reports and the diagnosis also. So this guy comes with the report in his hand and just places in front of me like this and says, I'm having jaundice and I'm having high SGFT and SGPT counts. It was like some 181 was SGOT and SGPT was 658. The bilirubin was 10, and he's telling it that yes, I am having jaundice, so please give me some medicine. Now there are so many times that it happens so that we have such patients where they won't give much symptoms, or they are so well educated that they do not want us to probe into their symptoms, their case history. So I just try to inquire what's happening with you. He's a software engineer, and of course, so he has well researched his topic, whatever he is suffering from, and he tells that doctor, there is little heaviness in the liver region. I have not been able to eat well. The appetite is lost, but my stomach is quite full. I feel full all the time. I don't have nausea, I don't have vomiting, and the sleep is also partially disturbed. I cannot sleep well since the past few days, since say a week or so, and I don't have any dreams. Now, when I try to ask what's happening further, and he says, I told you there is heaviness in the liver, and the appetite is lost, and there is full feeling in the stomach, and he does not go further. It so happens that some patients may not go further. There is a limitation. They may not be able to express, they don't want to express. There are many reasons, but we as homeopaths should be well equipped to handle such cases also. So I will just give you a glimpse into the most easiest and most flexible way this morning, which can open up a lot of things for you. It can transform your practice, I would say. And this is the use of ReferenceWorks. So what is characteristic in this case? He is having jaundice, he is having loss of appetite, which is common, he is having fullness of stomach, and the sleep is not good. So I take only two main things in the case. One is jaundice and the other is sleeplessness. So you see, we perform some searches in the program, and it opens you to the whole list of say 800, 900 books and gives you a avenue to search from all the possible literature, right from Allen, Herring, Henneman, and to the latest Morrison, Scholten, and Sankaran and all books. So I just put over here jaundice within 3 words of sleeplessness, and when I perform this search, a rubric is created on its own, a super rubric which is called by this program, because it has a lot of possibilities. We will discover how it helps. So here it opens up 3 remedies from my literature, from my library, and the remedies are chamomilla, myrica, and roost tox. So on your screen, what you see right now is a reference string with 8 references for these 3 remedies, and it has the exact mention where jaundice and sleeplessness are in that particular remedy. And what you read over here in the third reference, I see it's myrica. It's a very specific remedy, a very local remedy, what Dr. Sarkar calls organ remedy. What reference it has? It is from Zandwood 2015, having sleeplessness, jaundice in, and the mention of the source is boring. So sometimes it may so happen that I may not be able to go to the repertory to search a particular rubric, a sub-rubric in a particular chapter. But with the help of ReferenceWorks, I can open up the whole possibilities of searching the symptom of the patient from provings, materia medica, case discussions, repertory, and all the possible books. So he was given myrica 30 TDS for 15 days because this remedy has action on the liver and also the feeling of fullness in the stomach and the liver region. And what you see in the next 3 days, the first he came was on the 9th of March, and in the next 3 days without any other medicine his levels dropped by 300. The SGPT became 394 and the SGOT was 111, and he was feeling quite better. He could sleep and he could also have a good appetite, slowly improving a bit. And as we see the progress in a week's time, the levels reduced drastically with the improvement in the patient. So this is the exactness what you will find with the help of this newer tool, which is ReferenceWorks. Now let me share the second case. It's a very interesting case. The case was taken on the phone, so I very well remember. And nowadays, you have this WhatsApp, so you have images of patients and the reports, and they can send it anytime and anywhere, and you can just get it instantly. So this is a case of a swelling of a child, and the patient just sent me this image that, doctor, she's having swelling in her left hand since morning, and there is no history of any injury or any bite or anything which we can remember. I tried to probe. So just for clarity, I asked for another picture again, and I could see that there is lot of swelling in the hand, lot of redness is there, and the patients are staying little far, so they couldn't come to take the medicines. But they told me that we can approach the nearest pharmacy and get the medicine, whichever you tell. So I told that, how has the swelling developed? Since when? They say it's there since morning. And there is no problem as such. I tried to ask further, can you touch the swelling? Can you see whether it is having a pressure, or whether it is having pain, or what is happening with the child? And they say that we are trying to touch since morning and ask her whether there is pain. She's a small kid, say 1 year old, and she does not react to anything. I mean, she has a good tolerance and there is no pain also. So I try to ask, what else is she having right now? Any other symptom, any other complaint? And she says, the mother says that she is as usual, doctor, she is very irritable, very capricious, very obstinate, and there is coryza since past few days. There is nose block, and right in the middle of the sleep, she wakes up frightened suddenly, rubbing her nose and just trying to breathe. So we think there is little discomfort in her coryza also, and some stools are not clear, but the urine is good. So now what you have to do over here, now the patient is still on the phone, we are trying to get the symptoms as much as possible because we cannot examine, we don't know the patient in front of us. So what is characteristic in this case? Is it the swelling? Is it the behavior? Is it the sleep? What we need to get is all the symptoms together and to focus on the totality and take this further. So what I could just derive from whatever history I got was the confirmed characteristics. As you can see, the swelling, which was painless, it was so swollen, but it was painless. And the sleep, she wakes up from the sleep as if frightened and as if trying to gain some breath and startled and whatnot. And the other common things, as I was already seeing her, so I knew that she is irritable, she is capricious, she is obstinate, and is currently having this complaint of nose block. Now, what we can do is that we can just focus on what is confirmed characteristic in this case, the exact characteristic. And what is the most simplest approach we can take over here is with the help of ReferenceWorks. So what I do is just put the keywords of the case, which is swelling within 3 words of hand, within 3 words of painless, and I am telling the program to search in the same remedy startling sleep during, which just the words starts 3 word sleep. And when I do the search, I get a super rubric as I told you, and it has some 5 remedies which matches this totality from the entire literature I have: arsenicum, euphrasia, lycopodium, Sikale, and sepia. And when I try to see the reference, 38 references which I get for these 5 remedies, the reference thing which opens up, it shows me some mention about lycopodium. Having child starts from sleep rubbing its nose, exactly as I wanted. Can you see this? So I go to read Allen's keynotes, lycopodium, and I can see catarrh, dry nose, stopped at night, must breathe through mouth, snuffles, child starts from sleep rubbing its nose, and the whole symptoms further. And the next reference which we wanted was red and painless swelling of the hands from Clark's dictionary. So I can combine all the materia medicas, all the repertories, all the case magazines and the whole literature together and make a search and focus on what I want with the help of the symptoms of the patient. And I just told them to approach the nearest pharmacy to get this medicine, lycopodium, and just give her 1 dose and wait for the next day. And you can see this was the swelling on the day 1. The very next day in the morning, they sent me this picture. The swelling was almost 80% better, and the coryza was also better. So what I would like to share over here today is the exactness what you can get with the help of the program ReferenceWorks. The last case for today, which I would like to share, is of a 35-year-old patient working in a multinational company. Comes with weakness, cramps, loss of appetite, stressful job. It's been there since the past 2 months, 3 months. Lot of stress is there, lot of cramps, loss of appetite. And he shows me these reports which a local doctor has done. That is, sugar levels are really high. Fasting blood sugar was 206 and post lunch sugar was 267. So I asked him what's happening, what's the current situation, and he says that there are he has recently changed the job since the past 2 months and joined a new company, and he has a very good post. He is very punctual in his work, very particular, very meticulous in performing all the job he has been given. But he says he's very sensitive. My new boss is very strict, and I cannot take the domination he does every time. He shouts and he he tells me to do additional job of someone else which I cannot take, and he keeps on shouting which I don't feel good about. And I keep on thinking about this thing again and again, again and again, again and again. And while sleeping, I have lot of anxiety. My sleep is disturbed. Did I make the right step to join this job? And it's a good course, but I'm worried. And since then, since the past 2 months, I'm having all these complaints of weakness, of stress, of cramps in my legs and loss of appetite. And I approached this doctor, and he got me investigated, and I am now having high sugar levels. So I took a few rubrics for this case. The first one was anxiety, sleep disturbed with. The second one was brooding because he constantly keeps on thinking about his current job situation, his boss, and the single thing he keeps on occupied and he does not go further. Impressionable, susceptible. This is the third rubric. He feels really bad and he gets affected by these things. And very meticulous, does lot of work, very punctual and industrious, very industrious person. I asked him further, since there are so many remedies coming up, I asked him that what else is there bothering you? So he tells that one incident happened in the office recently, say a month ago, and I had some documents, and I have to always assess these documents and send to my boss, and he has to assess it, and there were a few mistakes in it. But I have a whole team working behind this to rectify these mistakes. It was partly my mistake what happened, but the boss blamed me so much, and I feel that I have done wrong, and I feel that I will do more mistakes now. I really feel sad because of this small mistake, and I don't feel like good. I feel sad, just that. Now you can see in the repertorization you have so many remedies coming up. There is ignatia, there is sepia, there is veratrum, there is calica, matramule, there is iosamus, lachesis, lyco, pulsatilla, cyclamen, cannabis in sativa and all. Whatever broader rubrics we could take. Now there is no likes, no dislikes in the patient, but only this one feeling which I feel was very, very, very strong. And it was that he feels sad. While saying this, he was so expressive and so deep that I felt that this should be the entry point in the case to give a particular remedy. This should be the symptom which I need to find in my repertory. So what I did was, I had no clue about what rubric I will be searching for, and I just make a broad search in my program about SAD, and duty, and I get only one rubric for this exact patient expression: sadness conscience of, as if he had committed a bad action or not done his duty, and the remedy was cyclamen. Exact rubric of the patient, and I searched it instantly. So this is what I would like to tell you. To get the best in your practice, you need that exactness. And now what I do is further, I search for something really specific. I search for everything related to duty from ReferenceWorks only for the remedy cyclamen. And what I get was really an eye opener. Some 74 references for this remedy and having lot of mention about duties, and you can see the sixth line from top mentions they grieve over neglected duty, conscience as if he had not done his duty or committed a crime, and grief neglected duty over, and again delusions neglected his duty he has. So this was the exactness which I could get, and I gave him cyclamen 200 OD for the next 15 days, and you can see the sugar reports on the 7th of Jan 2015. The fasting sugar was 206, the post lunch was 287, and in a few days it reduced drastically. Fasting sugar was 129, post lunch was 263, and so on and so forth. I have been monitoring him without any allopathic medication. His current reports, fasting sugar levels are 142 and the post lunch is little higher, but it is due to some stress at the job, but soon I think I'll have to increase the potency and it will really help him. So what I would like to share with you is that in this follow-up which I saw, the quality of his life improved. The stress is lesser. He can confront his boss. He can work normally at the same place where he was, and there is lot of freshness feeling. So that is the exactness and the ease and the flexibility of the programs, especially what I showed you a few cases just now about a few pathologies, and this is what the programs can help you do, to focus on what you want, having the largest library and the path breaking tools. I will just give you the details of my colleague who can guide you to the nearest consultant, because we have a team of doctors. So you can just note down his email ID, pratik@synergyhomeopathic.com, and you can see his number also on the screen. I just want to share that these things can change your life and your practice in a different way. It will not only open your cases but also help you learn in a totally different outlook which you have never been used to.